live educational report, our weekly live stream where I discuss things that we're doing here at Chicago Arthritis and Regenerative Medicine, and questions that I frequently get or have recently gotten from either clinical staff in the office or from patients. The idea being that we're focused on non-surgical treatment and management of arthritis, tendonitis, injuries, and back pain, and helping to clear up issues, concerns, and common misconceptions that people may have to keep them on the right path for safe and effective care. So, I had a recent case that I think is a really great example of instability and inflammation, how they can be combined. So a friend of mine came in with right ankle pain and swelling, and he'd been told at a urgent care center that he may have gout. They made that clinically based on the fact that he had swelling in the ankle and the foot, not really based on anything else. So is that really his diagnosis? Does he have something else going on? And so, when I examined him, I mean, he definitely had swelling in the ankle. But really, to properly make a diagnosis of gout, you need to have either fluid from the joint that was extracted, that you then analyze at the lab and then confirm that there's actually gouty crystals. Number two, there should be an elevated uric acid level in the blood. Or number three, there can also be some really classic ultrasound or CAT scan findings that you can see in gout, where there's a layer of crystals over the joint. And in his case, he didn't have any labs. He didn't have any synovial fluid or joint fluid analysis. So when I examined him, he definitely had swelling in the ankle, a lot of tenderness. When I looked at his ultrasound, he didn't have any significant fluid in the joint. He had a lot more chronic tendon and joint changes, and I'll talk about that in a moment. And he had a lot of swelling in the subcutaneous tissue. That's the tissue outside of the joint and the tendons and the ligaments. And he did also have a significant tear of the most commonly injured ligament in the ankle, called the anterior talofibular ligament. And so my assessment at that point was that I don't think this really fits with gout. I think you really have some chronic issues in the ankle, which is due to his history of playing competitive squash, which has intermittently caused some pain in the ankle post-playing. And more importantly, more recently, it looks like you've probably torn that ATFL ligament. And I think that's what's been causing all your pain and swelling now. So interesting, because number one, inflammation and instability go together. So in his case, he has instability because of that ligamentous tear that has caused some chronic changes in the tendon in the joint, that's caused chronic discomfort. And more recently, that instability has caused more significant pain and swelling throughout the ankle. That instability is what's causing the inflammation. That's different than gout, where because there's systemic inflammation from this crystal disease, that systemic inflammation then leads to inflammation in the joint. That's a different deal than instability causing inflammation. So in his case, our plan is going to be, number one, to basically a lot of activity modification, let this current sort of inflammation calm down. He's going to be wearing a boot for his foot for the next week or so, and then we'll reevaluate it, and then likely end up utilizing platelet-rich plasma to help treat his instability issues. Basically, the goal being, can we treat instability, which will then support the joint better, which will then lead to a better stable joint, less inflammation, less stress on the joint and the tendons, and less pain as well, and just an overall better outcome. So important to understand that you want to look for objective findings. And on top of that, you need to understand that instability can drive a lot of inflammation long-term as well. Second question I had was, when we utilize treatments like bone marrow-derived stem cells, do we need to use sedation? So what's interesting is that most people, when they hear that term bone marrow, it kind of freaks them out, which is understandable. But the reality is that we do this in enough people, and we know how to keep people comfortable, that the bone marrow aspiration itself, that on average, the discomfort associated with that is roughly a 3 out of 10. It's very manageable. The re-injection is really just a injection into the areas that need to be treated. We can do that with just local anesthetic. The exception to that is what we've come to realize is that for people that have more moderate to advanced arthritis of the knee or the hip, that there's pretty good evidence now that besides treating the joint and the ligaments, when you're utilizing someone's own bone marrow derived stem cells, in those cases, you should be also injecting into the bone. And in that case, sedation is important because it's not so much putting the needle in place where it needs to be injected, but it's the fact that injecting into the bone is very sensitive because that's an area that is chronically irritated and driving pain, actually. And the interesting thing is that you can see a lot of things on MRI imaging. The vast majority of them don't actually correlate with pain, but seeing inflammation of the bone does. And so treating that can make a better difference long term. There's enough good evidence between Philippe Hernigue from France and Miquel Sanchez in Spain, really a significant number of patients that have been treated in that manner, where we're progressively doing more and more of that kind of treatment, where we're treating not only the joint and the ligaments and the soft tissue structures, but also treating the bone. And when we need to do that, yes, we use sedation for sure. It just makes it much more comfortable and easier to do. The last question I had is, what sort of restriction do you expect after any of these kind of injection treatments? And the reality is, if you're injecting your own cells, your own bone marrow derived cells or your own platelets, that you're going to have more inflammation for at least the first 3 days and some stiffness for the first week. That stiffness can be for a couple of weeks. And so for most people, you should just expect that your normal daily activities, you can still do them, but you'll want to do them with less vigor, less intensity. If you do work that requires more heavy labor, you would definitely want to reduce that for roughly 3 days up to a week after treatment. And from an exercise standpoint, low impact exercises are generally okay to do. More high impact activity, you'd want to cut down for the first 1 to 2 weeks as well. So the thing is, most of our treatments don't really require really more significant bracing or limitation in activities. It's more activity as tolerated. The exceptions would be if you're getting a treatment that requires you to use, let's say, a crutch or crutches for the first 3 days, just because there's more inflammation or discomfort. Or if you're treating something like a foot or ankle where you know there'll be more inflammation and they should probably wear a boot for the first 3 to 7 days. So there are some exceptions where activity and restrictions after treatment may be a little bit more, but the vast majority of these treatments don't really require significant limitation in activity immediately afterwards. It's more paring down the activity for the first few days after treatment. Wonderful. Well, if there's no other questions at this time, I appreciate everyone's time. As a reminder, we do this 2 times per week, Mondays and Wednesdays. In addition, I'm also doing a webinar this Wednesday afternoon, 4 p.m. Central Standard Time, on regenerative medicine treatments for shoulder pain. We'll be talking about how we utilize regenerative medicine for not only rotator cuff injuries, shoulder arthritis, shoulder strains, and in general, understanding what's the best way to utilize these for shoulder-related injuries and how we can improve your pain and function without utilizing surgery. Until next time, thank you for your time and have a good day. Bye-bye.